Since being named Florida Surgeon General, Dr. Joseph Ladapo has been making statements about COVID that have been contrary to the CDC recommendations. Some of them I've agreed with, others I have not. Now he is advocating for a complete stoppage of the use of messenger RNA vaccines. So let's talk about it. Hey everybody, it's Dr. David. So happy New Year. Hope everybody's doing well. In my continuing effort to help educate people to sort through information that could be sent through all different types of sources, I try to do my best to try to interpret information, to give my own take on things, point things out that people may not ordinarily see. And being a pediatrician for 25 years, and people who have read medical articles and studies and such like that, I can sift through these things and kind of see through and find information that, again, some people may not found. Now, what we're talking about today is this brand new note that was sent out from Dr. Ladapo. He's the Florida Surgeon General. And this was sent out and widely distributed. I received it as a doctor, but news articles received it. In fact, I already did an interview for the local Tampa affiliate from ABC today about this. And basically, he is saying that there should be a complete cessation, a complete stopping in the use of messenger RNA vaccines for COVID. Okay. Now, this was issued January 3rd for those who are not watching this today. I guess you're always watching it today, if that makes sense. Okay, but what this public statement was called, and I'm going to do more reading today than I normally do because I want to make sure I get this information right since I'm doing a lot of quoting here. Okay, so the statement itself was called, Florida's State Surgeon General calls for halt in the use of COVID-19 mRNA vaccines. Now, in this particular memo, he first mentions, and it's a memo from the Department of Health, and then a quote from him. Okay, but he's the one who wrote the whole thing. It's obviously being released by his office. So what he wrote is a memo noting that starting on December 6th, that's when he sent a message, a letter to the FDA, where he posted questions that were related to the safety assessments regarding messenger RNA vaccines, and also what he said was the discovery of billions of DNA particles within a vial of messenger RNA vaccine for COVID. Okay, on December 14th. The FDA issued a reply to this, and basically it was a rebuttal to Dr. Ladapo's comments. Now, in me reading through that, and I'll get into this a little bit more, some of their rebuttal, I think, made sense. Some of their rebuttal, I think, kind of side-skirted what he was actually asking. But again, I just want to try and get through this information so you know what to make of it. Okay, so first of all, this January 3rd statement, the one that just came out. Okay, so this letter outlines concerns regarding nucleic acid contaminants in the approved Pfizer and Moderna COVID-19 vaccines, the messenger RNA. Okay, and he talks particular about the presence of these lipid nanoparticle complexes, DNA from the simian virus 40. That's something that had actually been a concern back in the polio viruses way back in the day. I think this is like 60s, 70s, something like that. And also something called the simian virus 40 promoter enhancer DNA. This is a particular DNA that he was mentioned concerns of. He does point out that, of course, the reason why the vaccine is supposed to work, or that why it does work, is that the nucleic acid. So again, I shouldn't say again, nucleic acids, like DNA, of course, that's what our genes are. RNA, DNA gets read and converted into messenger RNA. There are other types of RNA in our bodies, of course, but there are some viruses that are RNA to begin with. They're not DNA, and SARS-CoV-2 being one of them. Okay, the nanoparticles are what were wrapped around the messenger RNA that once it was injected into the body would penetrate into the cell and then release the RNA that would then be transcribed into a protein. That's what proteins are made from, reading messenger RNA, and in this particular case, the spike protein. And then the spike protein was put on these cells and an immunological response by our immune system would see this as a foreign body, make antibodies and white blood cells against it, so that when a person would see the virus, that they would then have an immune response ready to go. Okay. One of the challenges that I've seen from the beginning of all of this is that unlike a traditional vaccine, which was when you give it to somebody, there's a set amount of the protein that the body reacts to. But with messenger RNA, and I shouldn't say from the very beginning, this is something that came out about a year in, that your body's ability to make the spike protein, well, the quantity that it makes, it can be different from person to person because messenger RNA can be reread and produce more proteins over and over and over again for a period of time. So there can be a variable amount of spike protein produced, which is also true when people get COVID, the virus itself. Then, of course, depending on how a person's immune system is able to control it, more spike protein can be made that way too. Okay, so what he's proposing is that these lipid nanoparticles wrapped around it, that if it's also found in the the DNA is mistakenly or whatever in the vaccine, that it could be promoted through. Now, one thing in me reading over this, which I was not clear about, they made the nanoparticle to wrap around, and as part of the formulation, I have yet to be able to find information that says that the free floating DNA would also be incorporated inside that nanoparticle lipid in order to be brought in. So that's an area. I may be wrong about that. If anybody's aware of that, please send it to me. But that to me is, there's an assumption that's being made here that even if these DNA particles are actually in the vaccine, does that necessarily mean it's in the nanoparticle that's being transferred? We don't know. I don't know anyways. Maybe someone does. Okay. Now, of course, if it's being transferred into the cells, then the DNA could potentially, again, the thought here is that this DNA then moves into the nucleus. Now, there's a lot of question about that and uncertainty because messenger RNA doesn't typically move into the nucleus. It's not replicated there. It's replicated outside the nucleus. It's only in the DNA. That's where the genes are. That's in the nucleus. That's where the DNA is. So again, getting into the cells possibly, but we don't know. With these nanoparticles, is that then would this DNA be transporting into the nucleus to be incorporated into the DNA? Again, I haven't seen anything that says for sure that is happening. Okay, now because of this, he does point out in the letter that that in 2007. The FDA published guidelines regulating the limits of DNA vaccines that were referred to as plasmid DNA vaccines for infectious disease. And they outlined considerations the FDA did that uses these novel methods of delivering DNA integration that could theoretically turn a healthy cell into a cancerous cell, that this DNA could theoretically result in chromosomal instability, that it could then move to other parts of the bodies. Okay. Now, to be clear, this is DNA vaccines that they were talking about, not messenger RNA. And again, we don't necessarily know that even if the DNA is in the vaccine vial, that it's actually in a form that could then transport into the cells and into a nucleus. So lots of hypothesis there. Okay. Now, the DOH letter then goes on to say that on December 13th, the FDA replied to Dr. Ladapo. And Dr. Ladapo says that it didn't provide any information about the DNA integration assessment relative to this FDA 2007 concerns that they had expressed. Okay. Now, he says that the FDA also provided no evidence that these risks have been assessed to assure the safety of messenger RNA COVID vaccines. And that sentence is true because obviously providing no evidence if they didn't look, which we don't know, that could be an issue. Okay, but again, now on top of that, Dr. Ladapo then himself makes the following statement. The FDA's response does not provide data or evidence that the DNA integration assessments that recommended themselves have been performed. Instead, they point to genotoxicology studies which are inadequately assessment for DNA integration. So what he's saying there is that what they did do, this thing called genotoxicity, that it wasn't good enough to show that to make him feel comfortable about this. I guess that's the way of saying it. Okay. He also then said that that there could be this DNA could be integrated into the sperm or eggs and then passed along to further generations. And so the thing is, though, he uses a lot of may statements that it could, that it's hypothesized that, but nothing that he's really pointing out that there's no references to anything there. Now, he also does point to concerns about the potential health risks associated he then says that providers who are concerned about the mRNA being put into a person's body from the vaccine, that there is a regular non-messenger RNA vaccine called Noravax that can be used instead. So he does make that alternative recommendation. Okay, so now let's unpack all of this. So first of all, let's talk about the validity of Dr. Ladato's statement. Okay, so first of all, he references a particular paper that shows that has the mention that he says shows that the DNA is in the vials. Okay, this is from a researcher at one of the universities in Canada. But I just looked at it. First of all, it's a preprint. Okay, it has not been peer reviewed, and it's not even in any kind of medical journal. It's just a PDF that was sent out by the researchers. So, you know, they make the statements, they document the billions of DNA particles in the vial, but I don't see anything that like really can substantiate it because it hasn't been peer reviewed. For that matter, and being that I am not a DNA technologist, I don't know if that's a word, but you know what I mean. I don't know if the equipment, what they were using, if those protocols are even accurate, because there hasn't been any peer review for someone to say, yeah, that's the way you would check these things, versus no one's ever done that before. You're not using valid equipment. Again, we don't know because it hasn't been peer reviewed. Okay, now, but they do say that these billions of particles are there. Now, again, Dr. Ladapo does not make any reference, show anything that does show that's actually being incorporated into human cells. This is a hypothesis that he's making. Now, of course, science is based upon hypotheses. Every study, every concept in medicine, there's first a hypothesis that you then go on to prove. Now, of course, he hasn't gone on to prove anything. Okay. Now, again, when you use words like could, theoretically, it may, again, those are statements, but to me, those are more opinions and they're not fact. Okay. Now, if there was, but when looking at this, I like to use the term biologically plausible. What that to me means is that if there's not research that shows that A can cause B, right? If you can say that A can cause B and B can cause C and C can cause D, that means it's plausible that A could be contributing to D, but it's not proof. Okay, and there's a lot of inferring here. Okay, so I'm not saying that his theory is false. It could be false. I'm just saying there's no evidence to show at this point that his theory has been proven. Okay, now again, he does offer this alternative vaccine for those who do want it. I don't know anybody who's actually taken it, but it is widely available. I did put a link if anybody wants to know where to get this Noravax. And if they say I want to get a COVID vaccine, I don't want to get a messenger RNA version of it, I did put a link in the description where you can actually find those vaccines if you want. Okay, now in terms of my take overall. First of all, I think that this is an overstatement, and he is, saying that this is an abundance of caution. Okay, he is recommending that the use be halted. He hasn't made this isn't an official order. He's not saying that they're not allowed to sell it or give it anywhere in the state or anything like that. This is his opinion, and he doesn't flat out come and say this is his opinion, but I infer this is clearly his opinion, not something that is policy. Okay, but at the end of the day, we all need to make that decision on our own. We should weigh the pros. We should weigh the cons. We should use reputable sources. We should use multiple sources. Kind of seems like here there was one source being used to make this recommendation. Okay, but of course the individual factors still come into play. High risk people, elderly people of issues, they're obviously more at risk. I've made a video recently that shows that even when people are getting these booster vaccines, that the protection is not lasting more than a few months. So, of course, it's temporary, but if someone says, I want to get a few months of protection, that's their call, right? They get to make that call. Of course, making sure people's vitamin D and zinc levels, where you're getting vaccinated, of course, to fight off the virus. Make sure your levels are good chronically. You can't just be popping a bunch of vitamin D and expect it to make a big difference. You need to have your levels good. Same with zinc. And of course, we've talked many times about our immune support protocol that we've published before. I know our Patreon subscribers have it. Our patients have access to it as well. It's in previous videos. What you do when you first start to get sick, but also a similar protocol. If you choose to get a vaccine, supplements, vitamin A, zinc, vitamin C, and echinacea or arabinogalactan given before and after the vaccine. So now you have some more information, but overall, do I think that This will probably make some people, well, I don't even know how many people are on the fence now about vaccines in the first place. So I don't know how many people this will actually impact. But in my opinion, he's entitled to his opinion. He's entitled to have to present a biologically plausible thing. But in the same sense, the way it's presented to me seems like it's an overreach in the fact that it's just theory and that there's really no evidence at this point besides a non-published, non-peer-reviewed paper to back him up. Have a nice day.